to subscribe. We have a guest tonight, today, Scott Atlas. He's a senior fellow at Stanford University's Hoover Institution and a member of Hoover Institution's Working Group on Healthcare Policy, which is absolutely going to be one of the biggest issues in the next election. He investigates the impact of government and the private sector on access, quality, pricing, and innovation in healthcare. His book is Restoring Quality Healthcare, a 6-point plan for comprehensive reform at lower cost. It is out now. Scott, thank you so much for coming on. I appreciate it.
Happy to be here.
So give me an overview of what is wrong with our healthcare system. Seems to be in disarray. People are really worried about it. I think it was a motivating factor in the midterm elections. What's the problem?
Yeah, well, the big problem, and actually this sort of escapes the essence of the argument, is not about quality. And it's really not about access. It's about the cost of healthcare. And the reason that's a problem is because A, the government programs are unsustainable if the costs are this high, and B, the people vulnerable to that are the most to the high costs are the ones who depend on those programs, the poor and the elderly. And so we need to fix that, but we need to fix that without impairing the quality, which by the medical literature is the best in the world. And that's factually true. But somehow the U.S. healthcare system is pilloried by false accusations and indeed a very false narrative by people who advocate single-payer healthcare. The way to fix this, if I can just cut to the chase,
Please.
The essence of the problem about high costs is because people think someone else is paying. They don't care about the costs. The way our system is structured, more and more, we have made health insurance cover everything and minimizing the whole concept of a patient caring about the cost. If someone else is paying, no one even asks what it costs. As opposed to every other good or service, people use healthcare and not only don't know what it costs, but they never even ask. They get the bills after they use the good.
So insurance, I mean, this happens with cars, too. If your car is insured, the price of fixing it immediately goes up because they know that you think you're not going to pay it out of pocket. Should insurance be limited? Should it be limited what we can insure? Is that the way to solve that problem?
Well, the way to solve the problem is to put patients in a position where they care about the price and are rewarded for paying less. And because of that, they consider the value of what they're buying. That's why a cell phone, an iPhone that's in your pocket that's essentially a supercomputer from the old days, doesn't cost $10,000 because we shop around for it. And the way to make healthcare, people seek value in healthcare, is to change the nature of health insurance. The nature of health insurance should be what it was intended for, like insurance for everything else, catastrophic insurance. Unexpected, significant expenses, not routine use, not things that cost $100. And so when you get rid of all these mandates, most of which were doubled down on by Obamacare, where they minimize the cost out of pocket. And in fact, they gave you subsidies to buy bloated health insurance. When you get rid of that and you deregulate and you let people buy the insurance that they want, which is cheaper insurance with a higher deductible. And most healthcare episodes are not big, catastrophic, multi-$1,000 expenditures. Most healthcare is outpatient, scheduled, non-emergency, and most healthcare is relatively small cost. And so when you are paying out of pocket because there's a higher deductible, the insurance won't kick in right away. When you are paying, you consider the price. You see the price, you ask what it costs, and the reward, the system has to be in place to actually reward savings. And the big vehicle to do that are large, liberalized use health savings accounts that you keep when you die. In other words, you can roll them over in a tax-free way to relatives or to anybody you want. You can use them for, say, your elderly parents. They're double the size of what they were. You actually are rewarded for saving. A very sort of basic point is a tax deduction for healthcare makes a dollar spent on healthcare more valuable than some other dollar. Whereas a health savings account, not only is it a deduction, but it rewards the saving of the money if you get to keep the money or use it for health care for your elderly parent or roll it over. And so you care what you're spending.
So I see a number of political problems with this. We're talking to Scott Atlas, the author of Restoring Quality Healthcare. For instance, I hear people saying, and I sometimes hear the president of the United States echoing them, there shouldn't be a mandate. You shouldn't be forced to buy healthcare, but at the same time, we need to cover pre-existing conditions. When you cover pre-existing conditions, you're no longer talking about insurance. You're talking about government healthcare, it seems to me. Is there some argument that would win through to people on a subject like that?
Well, I think the argument has to be made. The argument has to be articulated. And I would say just off the bat, the Republicans, the conservatives, have done a very poor job of articulating the problems with single-payer healthcare and the positives of their vision of healthcare. It's a little bit complicated, but it's really not that complicated. Here's the issue. You can't just say we cover pre-existing conditions no matter what if you mean that you buy insurance for the same price even after you get sick. And that's what Obamacare does.
Right.
Because then you're only going to buy insurance after you're sick, and you'd be foolish to buy insurance while you're not sick. Therefore, the only people who are insured are heavy users of the health insurance. And therefore, the whole concept that it's unsustainable. The health insurance itself, it goes bankrupt. But the Republicans and conservatives do support covering pre-existing conditions with the following nuance. And the nuance is that you have to have some incentive to buy insurance before you're sick. Otherwise, like I said, the system's unsustainable. And so the incentive to buy health insurance before you're sick is A, to make sure there are cheap health insurance options available, not bloated, massively mandated coverage, all-encompassing insurance, but more catastrophic insurance, higher deductible, cheaper insurance. And then secondly, if you have insurance, one example would be if you have insurance before you get sick for, say, a period of 6 months, then you are insured even after you get sick for the same rate. Okay, you can't get your insurance taken away, and you can't get your rate. That's assuring people get coverage for so-called pre-existing conditions, but you should have to pay more if you sit there and game the system. If you wait, have no coverage, and then after you get the diagnosis, okay, now I'm going to buy coverage. Well, there has to be some disincentive to do that. There has to be. It doesn't mean you're not insured, though. See, this is what the previous model was, and this is what's being distorted. Democrats are claiming that Republicans are saying, oh, you're not going to be able to get coverage if you have a disease. That's not true. No one is putting forth that model. There's not a single proposal by the conservative side that puts forth that model. But what they do put forth, and it's necessary to put forth, there has to be an incentive to buy insurance before you're sick. And that incentive is financial, obviously. And so you have to have it to be cheaper options, first of all, for insurance in general, but also some disincentive that if you buy it after you're sick, then you have to pay more.
When you put our healthcare in an international context, you have a situation where a lot of countries have single payer healthcare. They have government healthcare. They don't have to negotiate with the pharmaceutical companies because there's only one buyer. And so they don't have to pay what it really costs to develop and research a drug. And all those costs back up onto us. Is there some way for us to fight this? I mean, we create, I think, more new drugs than all other countries combined. I think that's right. So is there some way that we can stop paying for England's national health?
Well, I mean, here's the issue. You can't do what some have proposed already, even in the Trump administration, which is to say, okay, we're going to tag our prices to those of these single payer systems outside. Because when you import the prices, which is essentially what that does. You're importing their price controls.
Right.
And the price controls have an impact. There's no mystery to why we not only develop the drugs, but more importantly, we get the drugs before every other country. I'll give you an example. The NHS, the Nationalised Health System in the UK, they have a government-controlled system, but specifically for drugs. So, for example, they just put in something toward the end of last year that said that the government is going to so-called negotiate the price of new drugs, and they're not going to allow new drugs to be used until they get the price they want. And they gave themselves up to 3 years to do that.
Mm-hmm.
Now, what do you think that does? Well, we know what it does because we look at the data. These are factual statements here. This is not opinion. The NHS has less access, and in fact, sometimes no access to life-saving drugs that we routinely get not only sooner, but by far the greater number of those new drugs in the US. Most new drugs, by the way, are for cancer. So let's just say you're in the UK, you're dependent on NHS, and you have cancer. And the UK government says, well, we're not going to approve it because the price is a little bit too high for our system, and we get 3 years to negotiate that price. Mm-hmm. Okay, well, you got cancer. Yeah. You want to wait 3 years to get that drug? And what the impact is that people die. And we know for a fact that in countries with single-payer systems, if you just even look at the drugs alone, the diseases that are dependent on drugs, and these are the most important diseases: cancer, heart disease, stroke, diabetes, high blood pressure. The United States, by the medical literature, I'm not talking about opinion here, I'm talking about facts. By the medical literature, the published literature, the US patients have better outcomes. And that's all that this is about. We have better medical outcomes from cancer, stroke, heart disease, the biggest killers, diabetes, high blood pressure, all the serious chronic diseases, than all the systems with single-payer healthcare.
Yeah, they always mess up these statistics. I've seen them play with them. The fact that healthcare gets better and better, is there a difference between, say, our televisions get better and better, and the television comes out and at first it costs $2,000 and then pretty quickly it costs $600? Is there a difference between that and what would happen to medicine because you need the medicine and you can't negotiate and they have a monopoly on the brand? Is there any difference in that, or can that system, a free market system, work for medication as well?
Well, that system can absolutely work for all of healthcare. The difference that we see, why hasn't the price of healthcare dropped significantly like those things that you just said? The reason is very simple. The government shields patients, and insurance shields patients from caring about price. There is a shielding. There are barriers to competition for people's money based upon price in healthcare. That's exactly the problem. And so that's why the real solution to these things. And remember, the arguments are fallacious that say, oh, you can't shop for healthcare from the back of an ambulance. Well, that's true, except 5% of medical expenditures are emergency. 5%. Nobody's saying that, hey, you're going to be having a heart attack and you're going to say to the ambulance driver, wait a second, let me get the prices here. No. But what we are saying is that 60% of medical expenditures in the United States are outpatient. These are scheduled things. And not only that, we know it's already proven from the literature in specific medical care, both from diseases that were never insured, like, for instance, in the beginning of LASIK surgery for vision correction, or certain plastic surgery procedures, or MRI screening head to toe. These things originally were not covered by insurance. What happened? They came out, thousands and thousands of dollars were prices. People competed. The cost came way down.
Yeah. I have to stop you there. I'm out of time, but I'm glad to hear that logic holds true in medicine as everything else. Scott Atlas, a senior fellow at the Hoover Institution up at Stanford. His book is Restoring Quality Healthcare, a 6-point plan for comprehensive reform at lower cost. Thank you very much for coming on. I hope we get to talk again.
Sure, Hope. Thanks for having me.
Thanks a lot.